Hi, I'm Dr. Rick deShazo. Thanks for joining us for this third edition of Mississippi's Big Problem, our look at how obesity in the nation's fattest state is affecting our future. We've been at this for a while now, and every story we've done has had an impact on us. So far, we've shown you how obesity affects the regular Mississippi family from health to finances. We've also shown you people working to make a difference, from farmers markets on the coast to revamped school cafeterias in North Mississippi. We've looked at religion's role in the epidemic and how the Bible Belt could tighten things up a few notches. We've also taken you inside the human body to show you how obesity affects you physically. Every single one of these things are important and play a major role in Mississippi's battle against obesity. But tonight, we're doing something a little different. We're following the money from our overtaxed healthcare and insurance system to a niche industry setting standards, to a very poor community trying to make a change, to a popular program in Tupelo funded by taxpayer donations, to one hospital finding creative ways to help its staff and patients. Every single one of the stories tonight involve money, and each of them are important in the grand scheme of obesity. We hope you agree, and we hope you are inspired. So let's get started. We can think of a million different idioms concerning money. Money is the root of all evil. Follow the money. A penny saved is a penny earned. Money can't buy you happiness, etc., etc. All these sayings have their own meanings that apply to certain situations. But recently, we heard a new one that made us think.
One man's spending is another man's income.
That was Cyril Chang, director of the Methodist and Le Bonheur Center for Healthcare Economics. And that simple sentence may just be the bottom line in Mississippi's battle with obesity. It draws some very interesting ethical lines. It's a proven fact that Mississippians who are obese are less healthy, cost more to treat, have longer hospital stays, and use more pharmaceuticals than fit Mississippians. That means money for doctors, hospitals, and everyone else who treats an obese patient. So, should economically impoverished Mississippi even try to get healthy?
There are arguments in a perverted way saying that why bother with fighting this public health epidemic? After all, it might be to Mississippi's advantage to remain overweight, for example. After all, obese individuals live shorter lifespan, and so they have higher mortality rates. And to be very blunt, dead people do not use health care. And there's a saying in healthcare that death is cheap.
Let's look at the basics, the numbers. We know that it is going to cost a lot of money to treat obese Mississippians in the future, to the tune of about $2,000 extra a year by 2013, to be paid by every single person in the state, young or old, skinny or fat. We also know that 80% of employer medical claims in Mississippi are due to obesity. And finally, from 1987 to 2001, 27% of the increase in medical costs were directly attributable to obesity. Now let's look at federal insurance programs like Medicare and Medicaid. Mississippi has the highest Medicaid match in the country, meaning that for every $1 that comes from the state budget to pay for Medicaid, the federal budget throws in another $3. That leads to millions upon millions of dollars being pumped into the state economy. It's going to doctors, nurses, pharmacists, physician assistants, home health agencies, and beyond. With all this in mind, it puts a pretty big moral burden on certain groups of people. We spoke to Insurance Commissioner Mike Chaney about Mississippi's big problem.
The issues become one of ethics on the doctor's part, one of how much should we profit on obesity. When you have hospitals that are in the business for profit, and I'm not saying they're all bad, but you've got to weigh the ethical part of the hospital's ability to make money versus what you're doing to the patient that's in your hospital. Are you keeping them too long? You got to think about that.
On the surface, it seems that hospitals and doctors might be stuck in a very uncomfortable place. According to Marcella McKay, the COO of the Mississippi Hospital Association, doctors and hospitals are struggling, but for different reasons related to obesity.
The person who comes in who is obese and receives care is more likely to have complications, is more likely to have a longer length of stay, and the financial system at the current time sets limitations on what a hospital gets paid. If you come in with certain diagnosis, the hospital gets paid a certain amount for the care that's provided, regardless of what they spend providing the care. And so with caps on what can be paid and a population that tend to be sicker and have more complications, it's not a pleasant scenario financially for hospitals.
And it's not just the patients that are causing hospital costs to skyrocket.
In caring for not only obese patients, but obese family members who come to visit those patients and accompany them to visits, it is requiring the retooling of everything. Chairs, as simple as waiting room chairs, have to be larger. They have to support more weight. And then extending into the medical equipment, it gets very costly. Wider beds, wider and more durable wheelchairs, gurneys, commode chairs, tubs, showers. I recently saw a list of the equipment that would need to be modified or ordered new to accommodate the rate of obesity being seen in a local hospital in the Jackson area, and it was a 2-column, full-page list of the things that would need to be done.
It's a sentiment echoed by James Keaton, the Vice Chancellor for Health Affairs and Dean of the School of Medicine at the University of Mississippi Medical Center.
I mean, we have more, equipment is different for that. The equipment of just to get a CT scan or an MRI, the wheelchair, the ability to get drip started, all of that is much more difficult. Just simple thing of finding a vein and getting that started takes time and effort, a lot harder in someone who's obese. So there are problems with obesity that affect the economy and the cost of how we run a hospital system.
And the hospitals aren't alone in their struggle to stay profitable. Pastor Clara Reed is the owner and president of the Mid-Delta Home Health Agency, which has a lot of clients struggling with their weight.
Probably about, I would say 60% of our patients are obese, yes.
And just like the old saying goes, sometimes you have to rob Peter to pay Paul, just to make sure all the patients are taken care of.
We're on what we call episodic rates, which in the 60-day period, they may give us $2,200 for 60 days. Well, if you use up $1,500 of that taking care of a patient, the profit is the $500. So we use that money to help pay for services that these people need that Medicare or Medicaid or none of the other ones will reimburse you for. So the profit is less because of it.
It's something that Pastor Reed technically does not have to do, but feels like she must.
I give away more than I keep, and that's what I teach my people. And so when we look at the challenges that we have and the needs of the people, it becomes an issue of health and well-being rather than money and profits.
Despite this honorable attitude, hospitals and doctors everywhere still have to pay their bills. And so when costs go up, the cost is spread around.
We're paid by disease process a certain amount of money and how sick they are, but after that you don't get any more pay. So it behooves you to treat as quick and as efficient and with good quality. So you got to move the patients because the fixed costs stay the same. So if the patient's obese and stays there longer, we're going to have to pick up that cost from somebody else. So it's a huge balance.
So there's some cost shifting.
Oh yeah.
The increased cost for providing the specialized equipment and that sort of thing for obese patients, there's really no mechanism for reimbursement of that cost. It is a cost incurred by the hospitals that ultimately gets added into the room rate, the charges that are charged for services, and will be ultimately billed to all patients because it's absorbed into the general budget.
The same problems seem to affect the insurance world as well. Someone has to pay for those extra costs, and it will probably be you.
I think there is a connection between obesity and insurance costs. A lot of people would say we don't agree with that. The jury's still out. But when you take people that are obese and you put them within a risk pool of people that you have to insure, it's certainly going to increase the cost of insurance. That's common sense. Just think about it. It's common sense. So obesity does affect insurance.
So what appears to be the lesson here is that obesity is bringing a ton of money into local economies, but it's costing everyone more money that could be used for something much more important.
It has made our healthcare industry very prosperous because of the patients visiting doctors and hospitals. But on the other hand, at the end of the day, long term, if you will, society, the state as a whole loses because money spent on healthcare due to obesity could have been spent on something else, such as to strengthen education, infrastructure, which in the long term can be more beneficial to the state.
And in the end, all of our experts agreed that there is more to the issue than profits and losses.
It's not about what the state gets on money. It's about living a lifestyle that's healthy for your body and for your family and for your state and leaving the world a little better.
Let's stop a moment and think, what do we hear about? Are we here about money, or are we here about taking care of patients? Now, that's a different animal. We all went into this session, and I'm just speaking as a physician, but nurses, everybody that is in healthcare, they're not there because of money. They're there because we went into it with an ideal that we can take a human being and let them have a healthy, educated life. Now, I'll worry later about the money. But if I can accomplish that, and when I say I mean all of us, if we can accomplish that, then that's what this is all about.
The debate will continue regarding obesity, healthcare, and the economy. But for one industry, it's clear. Bigger is definitely better. It's the American way, right? If you see a need, you fill it. And for savvy business people across the country and right here in Mississippi, the obesity epidemic means money. Some of the biggest names out there are catering to larger clientele, from casket maker Batesville Casket Company, who promotes their Dimensions line of oversized caskets for customers who are, quote, looking for a more comfortable fit for your loved one, to the Brylane Home Company, who has several websites devoted completely to products to aid the overweight person in day-to-day life. Need extra large bath towels? Here you go. Looking for larger size coat hangers to fit a larger size shirt? Look no further. And surely everyone needs a plus-sized recliner. Just head on over to your local Lazy Boy store for one of these. a recliner with a width of 54 inches. And it is the furniture industry, an industry that is key to Mississippi's own economy, that seems to be way ahead of the game when identifying this niche market of creating products for the overweight consumer. And it's a market that Bill Martin, director of the Franklin Furniture Institute at Mississippi State, says has plenty of potential.
Potential for the market is about $500,000 currently, but I think that is going to be growing significantly as we move forward.
We visited with Martin and his staff at the Franklin Furniture Institute recently to talk about bariatric furniture and the complexities that go into creating the different pieces. The Institute is currently working on research that could provide industry-wide standards used to build plus-sized furniture. So what would those standards be used for?
It would be used for manufacturers to establish a standard for building a piece of bariatric furniture, something that would hold a 5 to 7, 800-pound individual. Have all of the correct structure within the frames and the cushions and the paddings that would make the bariatric person more comfortable and would not create any kind of liability for collapse of the piece of furniture.
Liability is a huge concern for manufacturers, and it is one of the main reasons those standards are needed. Research associate Bob Tackett of the Franklin Furniture Institute has a kind of job you probably didn't even know existed. His job is to test furniture, and that's a bigger job than you'd imagine.
There aren't any tests that have been developed for heavy people, and so when a company makes its furniture, they don't have a test that they can look at reliably and say, okay, it passed this test, so it'll work for people who weigh, say, up to 400 pounds. And they need that kind of data.
So Bob and his coworkers are currently developing a prototype of a chair that will be used to set those standards. Hooked up to all types of sensors, it will measure the areas where the strain is usually the greatest.
The parts that are going to be tested the most are going to be the arms and the seat. They're going to have the largest because that's where people put their load at. Whenever they're sitting down or standing up, you're going to push out.
And after those standards are set and the furniture is made, even more tests, thousands of them, big heavy ones.
That's dropped repeatedly on each seat of a sofa or on a chair. And also, there's also a big drop that's dropped from a larger height, a one or two time drop, to see what a very large impact will do. And there's also back test that pushes on the back over 100,000 times. They have leg test, arm tests that push outward and inward. And well, basically the main units of the frame, which would be the seat, legs, arms, and back.
That's a lot of work and will take years to get done. But the folks at the Franklin Furniture Institute keep at it. After all, there's money to be made.
Part of our mission is to fulfill the needs of the furniture industry and give them market opportunities. And we felt this was a market opportunity for those who choose to enter the market.
Tupelo Manufacturing is one of those companies that is taking advantage of this niche market. Based in, well, Tupelo, and run by Northern transplant Mary Warner, the company is far ahead of many others when it comes to plus-sized and bariatric furniture, especially on a contract basis.
We make basically contract furniture, which is furniture that for hotels, dormitories, hospitals, nursing homes.
Tupelo Manufacturing has been making furniture for years in Mississippi, but it has been only in the last few years that they have noticed some pretty dramatic changes.
I'm laughing because if you notice how much room is here on this side of either side of me, all the furniture is just getting larger.
One of Tupelo Manufacturing's clients is the North Mississippi Medical Center, also located in Tupelo. As obesity increases in Mississippi, so does the need for larger furniture and equipment in Mississippi hospitals. Tupelo Manufacturing is in charge of making some of that furniture, including a commode chair used for hospitalized patients who aren't mobile enough to make their way to a restroom. But what makes this chair so different from the rest is its sheer size. General Manager Will Bond met with hospital officials to find out what they needed.
First started out where they wanted a plus size. So we went from our standard 19-inch seat width to a 24-inch seat width. We submitted the drawings. We even had their engineers come down, their nurses come down. We got everyone involved. And, tell us exactly what you want. You're the people that are dealing with this on a day-to-day basis. They came in, we designed it, took it out there to them at the hospital. Everybody got together and looked at it and said, I don't really think that's even big enough. And we were a little astounded because 24 inches, pretty large in the industry. So they came back and we went to a full 36-inch seat width, which is very, very large.
And bigger chairs mean more material, which means more money.
You're probably looking at 2.5 to 3.5 times the cost because of the extra wood, the extra labor. It's just a larger, more massive piece of furniture.
And there is really only one place for that extra cost to go: straight to the buyer.
And it's a factor that gets passed on to the customer. Because when you make it 2 inches wider, you use that much more wood, you use that much more fabric. Also, too, as the designs change, the construction of the furniture has to change.
So what was the progression for Tupelo Manufacturing and the commode chair? Will took us on a little tour.
All right, this is our first original model of our potty chair with the seat width of 19 inches. You can very well see anyone of what has now become average size, it would be way too small for. The second chair, we increased it to 22 inches. Gave you a little bit, but it still wasn't enough. Hospital came back and said, can you make it a little bit bigger? We went to the next one.
Whoa, this is a biggie.
That is 30-inch wide between the arms. And this model, North Mississippi Medical Center actually took back to their facility and deemed it was still too small. So they asked us to come back and enlarge it. So we went to a full 36-inch wide bariatric potty chair.
So they must have enough need for these that they want a number of them made.
They do.
You're not just making a few of them.
No, the actual ordering, I think on the bariatric side was like 60. So if you look at percentages of how many rooms they have, and they need 60 of those rooms to have these in it, I mean, it tells you what the problem is.
Yes, a problem for some, but good business for others. A business that is right at home here in Mississippi.
We may have the heaviest people in the world, but at least we can design a better product.